This is David Gutman, and we're going to be talking about the medication list in SequelMed EMR. For today's introduction to entering medications, we're going to be discussing the medication list that the patient brings in from his other doctors or from prior visits. These are differentiated from medications that you're going to be prescribing as part of your plan and medications that you'll be replacing or discontinuing as part of your plan. So let's get started with a patient who's going to be bringing in a list and says, "Doctor, these are the medications I'm currently on." So from our inquiry button, that's the I with the circle around it at the top, we're going to be looking for our patient. We're going to type in a few letters of their first and last name, and then clicking the search button, we find the patient we want, and then hit the red select and close button. The easiest way to enter the medication list is to begin by going down to the medication management section. To begin entering the medication list, we're going to start off by selecting the past medication icon, which is the RX button, and that's going to bring us to a box called past medication. The past medication box can be filled in starting with the drug box, which we're seeing here, where we're entering the medication Nexium, or we can use the search box if our medication does not come up. We're going to type a few letters into the drug box, and when it comes up, we're going to select the name and dose of the drug, the SIG, the quantity, and the number of refills. You don't have to enter the number of pills because this is a current medication list and does not necessarily relate to medications that you're going to be prescribing. They may be from another doctor. But if you may want to renew them at some later point, then enter the quantity and the number of days supply. Don't forget to put something in a qualifier. I usually use each. You may also use capsules, drops, tablets, whatever the appropriate quantification is. When the medication does not show up in the drug box, we'll click the magnifying glass and hit search. We'll type in a few letters and select the most appropriate medication. We pick our SIG, but because this is an outside medication, it's not really important to enter the day's supply, quantity, or refills. So let's add in allopurinol now to our medication list. We're going to add in a few letters, and allopurinol pops up. We're going to choose our SIG, and because we may want to include this as a medication we may later renew, we'll put in a 30-day supply, and it will put in 30 tablets, and we've got that added in, as you can see. Now let's go through our medication list, and the patient is no longer taking Enalpram, so we're going to hit the stop button, and we're going to delete the visit date because it's not part of our plan. So we're going to press the delete button, and we're going to hit OK. Now he's not taking both atorvastatin and Lipitor, so we're going to hit the stop button, and we're going to choose discontinued, and we're going to get rid of the visit date because we're not going to be part of our plan to discontinue it. Now we're going to review our medications, and Synthroid was reduced in dose, so we're going to type in Synthroid and try to replace the 200 microgram dose. We don't see the dose here when we type in a few letters, so we're going to hit the search button. We don't see the dose that we want, so we're going to type in a few letters and hit the find button again. And we're going to see a list of different doses of Synthroid, and to make it easier for ourselves, we're going to add the different doses of Synthroid to our common medications. That way next time we won't have to search for them. They'll just come up when we type in a few letters. So we're going to hit the various doses that we'll likely use and hit OK with each one, and we press this star button that adds it to our common list. We want to use the 150 microgram dose, so we hit OK, and we want to replace the 200, so we hit the replace button. Now you see it says prescribed, and we're going to hit the don't print button to change prescribed to ordered, and I'll come back to that in a few minutes. Now Ramipril, we're going to exchange this. We're going to replace it with enalapril. We don't see the dose that we want for enalapril, and so we're going to hit the search button again, and we're going to enter into our search text enal, just a few letters, and hit find, and the list of different enalaprils will come up, and we'll see that there's a flyover that allows us to see what the dose is. We'll add the 10 milligram dose to our common list and hit the select and close button. So now we're going to replace, we're going to highlight Ramipril and hit the replace button. Now again it says prescribed. We don't want prescribed. We can either come up here and hit the don't print button, or we can go to medication management, and then under the order management tab, go to our medication that says prescribed. We have choice of e-prescribe, don't print, or print. We'll hit don't print. Ordered is the only acceptable prescription status. Prescribed and renewed are just transients. They're not part of the plan. They don't put the medication into the medication list. They're just transient way stops. So if you see a medication that has a prescription status of prescribed or renewed, you have to either change it to ordered or delete it, whichever is appropriate for that situation. So to change something from prescribed or renewed to ordered, what you need to do is either e-prescribe it, print it, or don't print it. Those are your three options. E-prescribing means you're sending it to your pharmacy. Printing it means you're going to put it on a prescription pad, an electronic printed prescription pad, the kind the state provides. Don't print means you're not printing it, you're just changing the status. That's what you're going to use when you handwrite a prescription. That's what you're going to use when it's just on the medication list. So we'll go to the top icons and find the don't print button and hit OK. We want to order the medication. Remembering, we're not actually ordering it, we're just changing the status from prescribed to ordered so that it appears on our medication list. I hope that you found this instructive, and remember to follow Progressive GI for further videos on YouTube, and join us at Reflux LI on Facebook and Twitter for discussions of a variety of GI topics.